study is a sub-study of a much larger study called the MONEAD study, which stands for Maternal Outcomes and Neurodevelopmental Effects of Anti-Epileptic Drugs. The lead PIs on that are Kim Ferd-Metter and Paige Pinnell, and Ryan May is the statistical PI and coordinator for the MS Center. So that is a very large prospective study of women with epilepsy who are pregnant, and it follows the women during pregnancy and their children, and we're following the children till 6 years. So the main outcomes of the study are looking at the maternal effects of epilepsy during pregnancy, including seizure frequency and obstetrical outcomes, as well as depression. And then the second part of the study follows the children to look at neuropsychological outcomes, including IQ and autism spectrum and behavioral stuff. So seeing if the drugs have an effect. This is a sort of sequel, if you will. It's an extension of a prior study known as the NEED study, which had done this and had been one of the sentinel studies looking at neurodevelopmental effects, and that was led by Kim Ferd-Metter. So this is a continuation of the study, and there's a lot going on with that study. I'm one of the site PIs for Northwestern. We were lucky to enroll a large subset of the women in this study in our Women with Epilepsy clinic, and so I have proposed this idea of looking at breastfeeding patterns in women with epilepsy as part of the MONEAD study and comparing them to our control group, which is women without epilepsy, known as healthy pregnant women in the study because they didn't have other medical conditions. And so we control the pregnant women with epilepsy to the women without epilepsy who are also pregnant. I think there's two ways to look at the data. Overall, the specialists who take care of women with epilepsy believe that we want to encourage breastfeeding, and we think breastfeeding is a good thing for women with epilepsy, for all women and for babies. We know that there are a lot of benefits to breast milk, right? We know that includes mother-infant bonding, decreased risk of many medical conditions in both the mother and the child, and that's well established. And a lot of concerns about potential effects of seizure medications in the breast milk have been mitigated by research. For many of the drugs now, we have both evidence and experience of their safety in breastfeeding, and a lot of that is due to the precursor study, the NEED study, which looked at 4 drugs. And in that study, the children of the women who breastfed actually did better on IQ scores at 6 years in terms of verbal IQ than children who were not breastfed in mothers with epilepsy. And there's one other large study that has looked at that and confirmed that. Not every drug has been studied, but those that have been studied, we have good data and experience. And in general, we do think for most drugs, the known benefits of breastfeeding outweigh the concerns of the seizure medications in breast milk, which for the most part are theoretical. So to answer your question, overall, I think there's 2 ways to look at our data that women with epilepsy were breastfeeding less than women without epilepsy. One is that overall, 75% of our women with epilepsy breastfed, which is a big improvement from comparison to the prior NEED study where 42% of the women breastfed. So in that way, we are there. Something is changing. We are, I think, a more permissive, medical culture. I think both on the parts of the epileptologists, neurologists, and obstetricians and pediatricians. So I think that change, based on the historical control, is an improvement, and probably is because of our experience and our data. But there's still a gap, right? There's a difference of about 15% in our study between the women with epilepsy and the women without epilepsy. And the women with epilepsy were about 15% less likely to breastfeed than the women without epilepsy. So that gap was statistically significant, and we need to figure out how to make them somewhat equal.